Okay, this video is called How Diabetics Think. And the first problem, the big problem with diabetics is they trust the conventional medical system. And there's a quote in the movie Animal House, the great comedy from the 1980s. You effed up, you trusted us, okay? They think that internal medicine doctors know how to treat hypertension, but they don't. The internal medicine doctor textbooks say that 95% of hypertension is idiopathic, essential hypertension of unknown cause. Nobody knows what caused it. Just take this pill, try to slow it down. So they know how to sell drugs, but they don't know how to treat hypertension. And they don't know sodium either. They're all confused about salt, and they think it's, sort of overrated as a treatment mechanism. They're not aware of the concept of ratios and K-factor. I've never met one who, talked to me about the Richard Moore book. Some of them, the smarter ones, and now maybe are reading a little bit about it, but in general, that is not standard knowledge amongst any physician. Okay, I've never had a physician who hadn't talked to me first who's ever read Richard Moore, the basics of plasma membrane ion pumps. Okay, typical patient says things like, my diabetes is under control, it's under control, I'm taking my meds, my sugars are okay. And, like Dr. McDougall had said, they're not aware of the point that you basically, all you got to do, you shouldn't be trying to keep it under control, you should be trying to cure it. You just eat the low-fat vegan diet and cure it, Why take pills and all the other stuff and stick your finger all these years when you could just cure it? They think that endocrinologists are the experts of diabetes and they know how to treat it, but they don't. I've met with the so-called best endocrinologists in a big city, and not a single one of them had read any of the basic papers. None of them knew about Sweeney, Rabinovich, Hemsworth, or Brownlee. I couldn't believe it. They didn't know anything about their own field. All they know is the drugs. That's been my experience. I realize the world famous ones like, Roy Taylor and Gerald Shuman know all this stuff, but the average garden variety endocrinologist does not know any of it. And then all they do is read their own books. Then you go to the kidney doctor, nephrologist, and you think they know how to treat kidney disease. They don't. The kidney doctors know how to write orders for a dialysis machine. They don't know nutrition. You'd be amazed at how little they know. Typical patient goes all the way from stage 3A, with a glomerular filtration rate of around 60, all the way down to 15 on dialysis without ever being told about a very low protein diet. They have an inkling of a low protein diet, some of them, but that's not good enough. So the recommended daily allowance protein recommendations are like 0.8 grams per kilogram per day. Low protein is about 0.6 grams per kilogram per day. But a very low protein is about 0.3 grams per kilogram per day. And some of them will freak out, oh, that's too low in protein. Well, look, Kempner fed his patients that they were just fine. He didn't give them any supplements. You can supplement them with what are called keto analogs, amino acids minus the nitrogen, or you can give them essential amino acid supplements if you needed to. But all the patients are afraid of protein deficiencies. And it's kind of like, Garth Davis, he's a guy who's a real smart guy, but he sold out. His book was really good, Proteinaholic. He's kind of sold out and become an olive oil salesman now. But in his book, he talked about interviewing patients, and they would all say, well, what do you eat? And they'd say, well, I try to get some protein for breakfast, and then my protein for lunch, and my protein for dinner. Their priority is to get their protein, and that's the last thing they need. Like a typical diabetic, you say, what did you have for breakfast? They'll say, oh, eggs, bacon, sausage, but no toast. Got to avoid those carbohydrates. And, like McDougall said, you should be counting your fats instead of your carbs. It's the fats that are the main cause of insulin resistance. They also think that the dietitians know what to recommend to them, but the dietitians don't. They usually recommend something like a Mediterranean diet, a high-fat diet, and they tell them to count their carbs. So they're not aware of the basic introductory literature on insulin resistance. So basically, the entire conventional system is grossly incompetent and makes sure that the patient will continue to have type 2 diabetes and never get better and never be cured. So it's kind of sad. Like I said, I've been a doctor over 30 years. You know how many protein deficiency patients I've seen in my whole life? Zero, none. I've never seen a single one. It's like the boogeyman of diabetes, all right, and nutrition. How many hypertensive and diabetic patients do I see? Every day, most of the patients I see are hypertensive and diabetic. It's so common, I don't even look in a chart. I just assume anybody over 50 is pre-diabetic, diabetic, and hypertension. I just assume it. And I do I do lots of procedures, okay? And not as many as I used to, but I still do a lot of procedures. I can tell you almost always the patient is hypertensive and diabetic. It's a rare event if they're not. Usually it'll be a younger patient with an incidental thyroid nodule or something who might not have diabetes and hypertension. But you give me any of the middle-aged and older ones, they almost always do. So they all do. That's what everybody should be worried about. So anyways, I feel sorry for these diabetic patients. I talk to them. I try to help them. But, a a lot of times they're pretty far along by the time I see them. I do the best I can to help them, but it's not easy. I can assure you they are not well advised. The people advising them don't know anything about nutrition, epidemiology, toxicology. So it's kind of sad, but that's how it goes. That's why the individual patient must learn to educate themselves if they want to have the best odds of ever curing themselves. You can cure, Roy Taylor, he cured 100% of his diabetes patients who had diabetes less than 4 years. He believes that you can cure most of them if they had it less than 8 to 10 years before the pancreas starts being destroyed, losing the beta cells to make insulin. Okay, you know, Pritikin, McDougall, they would say they would get the patients off their meds 90% of the time for hypertension and diabetes real fast. You know, with Kempner's patients, more severe hypertension, more chronic hypertension, it'll take longer. The more chronic the loss of the Windkessel effect, calcifications of the artery, the harder it is going to be to turn around hypertension. Diabetes, you usually can turn it around much faster. Anyways, I thought that was a little bit interesting. Hope you enjoyed that.